Hello everybody. Today we're going to talk about some dental metals, and that's going to include casting metals, solders, and wrought iron metals. So here are your objectives for this lesson, and you can stop the video to read through those, and here is another page of objectives. So first we're going to start with saying that metal is one of the most widely used materials in restorative and corrective dentistry. So we have porcelain fused to metal crowns, we have the substructure of partials, we also have amalgam fillings. So there's a lot of applications that metal can be used for in the mouth. Gold, though, has been used in restorative dentistry for years. Pure gold is extremely soft. It's ductile, meaning that it can be pulled into a wire form, and it's also malleable. Think of foil being pounded into a thin sheet. But due to its cost, other alloys are being used requiring less gold content. Please note that content for gold is expressed in carats and fineness. So a capital K means carat. 100% gold is 24 karat gold. 50% gold with some other alloy mixed in is 12 karat. So again, this is also expressed as fineness, which is a means of measuring the gold content in alloy as well. Pure gold is 1,000 in fineness, and if it's half gold and some other types of alloys mixed in, it is 500 in fineness. Alloys are used for casting procedures. They are tarnish resistant. They can be cast accurately and polished to a high luster. These are all very important for use inside the mouth. These alloys have greater tensile strength, ductility, and are stiffer than amalgam and offer less marginal fracture than what an amalgam would offer. The disadvantages to using gold is that it's terribly expensive. When I created this lecture, 5/2 of 2020, the cost per ounce of an ounce of gold is $1,657. So that's pretty pricey for gold. And the other disadvantage is that it is metallic in appearance. It's not very aesthetic. Gold alloys are classified by the American Dental Association and specified as type 1, 2, 3, or 4. They're classified because no single component of alloy meets the varied requirements for all types of dental restorations. We're also going to sneak in a type 5 throughout this lecture. Type 1 is a soft alloy and is usually used in the fabrication of simple inlays that are not subject to a lot of stress from chewing and occlusal forces. Type 2 has medium hardness and is used in all types of cast inlays that may include 2 to 3 surfaces and for certain posterior bridge abutments. So as we get into the higher type specifications, we have less gold mixed into the alloy. Type 3 is harder and can withstand greater stress than types 1 or 2. This metal is used for crowns, bridges, 3/4 crowns, and precision fitting inlays. Type 4 is extra hard, and it's strong enough to be used for partial denture clasps, precision bridges, and 3/4 crowns as well. The type 5 alloy is used with metals and ceramic alloys. It must have a higher melting point to withstand the temperatures when porcelain is fused to it. Their coefficients of expansion must be reduced to be compatible with the porcelain that is used. So it's just a very specialized type of alloy. Less and less gold is used here. This also is needed to provide a mechanism for chemically bonding the porcelain, but must not discolor the porcelain to achieve the aesthetics that we are looking for when we're using a porcelain product. Gold foil is kind of that type 1, which is used to form a restoration directly into the prepared cavity by compacting layer upon layer. So to reduce surface gases when this is being compacted and to make it cohesive, the gold foil is condensed into the cavity prep. If you think of very, very, very thin sheets of tin foil and turn it into gold, that is how many people had their teeth restored several decades ago. This gold foil is very ductile, very malleable. It's not used in dentistry today as it's time-consuming and complex. So the doctor would take their burnisher, dip it into a sheet of gold foil. It would static electricity stick to the burnisher. They'd place it in the cavity prep and burnish it into the preparation. They would continue to do that until the whole prep was filled up. So yes, it's very time-consuming, complex, and quite expensive. Cohesive gold is another name for gold foil, and this is gold that is clean, it's uncontaminated. In dentistry, again, it's used as a restorative material placed directly into the prepared cavity and welded by pressure, and that welding is done by the condensation and burnishing done by the instruments. Next, we're going to talk about noble metals, which are precious metals. The precious metals of dentistry are gold, silver, platinum, palladium, and iridium. These metals are biocompatible with oral tissues due to the least amount of corrosion that will happen in the oral cavity. They are predominantly used for casting of dental restorations. However, some silver may be found in noble metals, but it is not considered a noble metal as it does tarnish easily. Noble metals contain a minimum of 75% gold, with the remaining metals from the platinum metal group. Noble metals are highly resistant to oxidation, tarnish, and corrosion. The only one there that's in the noble metals is silver that does tarnish, but it's mixed in for other properties. The instability in the price of precious metals is a deterrent of use in dentistry due to its high cost. And refer back to that gold slide where it's over $1,600 an ounce currently. Platinum has a high fusion point, which is another name for a melting point, and it is resistant to corrosion properties. It does provide strength, hardness, and elasticity when it's added to gold. Platinum, when it's used in the form of a foil for the fabrication of a metal framework and constructing porcelain fused restorations, is a very great material to use. It is not used as much today due to the high melting point and difficulty with mixing with gold. Palladium is similar in properties to platinum, but it's a little bit less expensive than platinum. It whitens the alloy when it's used for silver. It helps to reduce the tarnish and corrosion with that silver. If it's used with porcelain, it can sometimes turn the porcelain green because of the silver content that is used in the alloy. At this time, it's currently more expensive than gold due to a shortage worldwide because it is used in high-tech digital gadgets for technology. Iridium is a metal that's added to refine the grained alloy, which increases strength and ductility. It is very hard and is very brittle with a very high fusion point or very high melting point. When we treat cast gold alloys, we can soften it or harden it. Heat is used to do both of these things. So when we soften the alloy, we are going to heat it very high to a very high temperature of 1300 degrees Fahrenheit for 15 minutes and then cool it rapidly at room temperature or in water, at room temperature water. When we harden the alloy, we're going to heat it to 700 degrees for 15 minutes and cool it in air. And those will alter the properties and the characteristics of the metal. Base metals are considered non-precious metals. They are combined with gold to improve the properties for individualized applications of alloys. These base metals are much lower in cost than the noble metals. These alloys do not depend on noble metals for corrosion resistance, and they're harder than gold alloys, which means they are more difficult to cut and to finish. So amalgams are made of base metals. Some partial dentures are made of non-precious metals. They're very difficult to polish, to cut, and finish. These base metals, since they're hard and strong, can be thinner and lighter in their finished restorations. And the examples of base metals that we have are indium, tin, zinc, copper, and nickel. Indium does not tarnish in air or in water. Indium can be used in place of zinc if patients are allergic or sensitive to zinc, and it has a lower melting point. Tin is a soft metal. It has a lower melting point. It gives a high luster and does not tarnish easily. When tin is combined with copper, it creates a bronze appearance. So that is how we get the metal bronze, by combining copper and tin together. When we think of a soft metal, think of tin foil, and that's really where we're coming from. Zinc is used as a deoxidizing agent during the melting and casting process, which allows the metal to be easier to cast. When zinc is combined with gold and platinum, this will increase the hardness as well as the brittleness of the new alloy. Copper is used to increase the strength and hardness of an alloy. It's also used to enhance the color of the alloy. So if you want the gold to look more yellow, we'll add copper into that mix. Copper assists in the heat treatment of cast alloys, and again, when it's combined with a zinc, it can produce brass. Nickel is combined with gold alloys in smaller amounts. This increases the strength and hardness of an alloy. Nickel has poor casting ability. It is a lower cost metal, and it has excessive hardness. It also has a poor bonding mechanism to porcelain and is stiffer than noble metals. And nickel has a sensitivity prevalence in 8 to 10% of the female population. So it is not used in a very high percentage in our alloys. And since we have a high sensitivity to nickel, labeling is required by all United States dental labs for appliances that are fabricated out of nickel, so that the operators and the patients know what is made up in their oral cavity. Next, we're talking about cobalt chromium alloys. These are used for partial denture frameworks and palatal areas in complete dentures. So if the patient requires, because of gag reflexes or other conditions, a metal palate on their denture, they can be made out of this cobalt chromium alloy. This metal has been used since the 1930s in dentistry. The content is cobalt, chromium, some nickel, a carbon mixture, molybdenum, and other substances. The American Dental Association specifications requires a composition of not less than 85% of the nickel, cobalt, and chromium, along with appropriate other physical properties. The characteristics of this metal make it lightweight because it is less dense than other metals. It is resistant to tarnish. It has a much lower cost than gold. It is strong and stiff to make it applicable to make a partial framework. And we need to note that this metal needs to stay away from chlorine mixtures of bleach, which will cause rapid corrosion. So do not clean your patients' partials with bleach, and instruct your patients to not use bleach when they are cleaning their partial dentures that have this cobalt chromium substructure. Casting alloys. So the American Dental Association classification has the noble alloys as the gold, platinum, palladium, and here we have these gold foil restorations. So this is where they can either be an inlay that was cast outside of the mouth, or it could have been a gold foil where it was condensed into those preparations. The base metals, as a review, is copper, nickel, silver, zinc, tin, and even titanium. We talked a lot about the lost wax technique in our last unit of dental materials, and this is a concept that consists of building up of the unit in wax to an exact replica of what the desired crown or substructure needs to look like intraorally. And here we have a look at porcelain bonded alloys. These are classified as high noble alloys. They can be noble alloys and base metal alloys. They just are looking at the content of the noble alloys that are mixed in with the metal. Here we have a base. Here we have probably a noble and a high noble metal baked with porcelain all around.